Okay, so today we're going to talk about how to find trigger points using electrotherapy. In most cases, therapists will palpate an area to find trigger points, and then when they treat those, they palpate a little more vigorously, which sometimes can be very painful for the patient and at the same time tiring for the therapist. So in our case, we're going to utilize electrotherapy to make this a little easier. We're going to touch the electrotherapy key. Then we're going to go to a waveform known as high volt. And then we're going to touch the customize key. Once we've done that, we want the frequency on 100 pulses per second. We want the cycle time to be continuous. Polarity in this case can be positive or negative. In this case, we're going to leave it on negative. So now what we're going to do is we're going to find the trigger point, and I'm going to turn the intensity up on the unit to about 20 volts so that there is some sensitivity. The other thing you're going to notice is that I have one electrode placed on my arm. I have the other electrode, a much larger electrode, placed on the patient's arm. Typically, I would probably put that on a larger muscle area like the quadriceps or the hamstrings or maybe even the low back. So at this point, now I'm going to put just a little bit of gel on my fingertip. And now with the gel, I'm going to start and I'm going to place my finger on the patient and I'm going to start moving it around. Wherever there's a trigger point, there's going to be increased resistance. So now, whenever I feel just a little tingle in my finger, I have now found the trigger point. I can keep moving it around and I can map out 2 or 3. For example, there's one, I feel a little tingle, I feel one here, and I can map out 3 to 4 trigger points and find those. Once I have found the trigger points, now what I'm going to do is I'm going to take the probe, I'm going to take this device, I'll actually unplug the electrode from myself and plug it in to the probe. So now at this point I have my trigger points mapped, and so now I'm going to take and I'm going to place the probe on the trigger point, and I'm now going to turn the current up until it becomes almost a noxious level. I want them to feel this, and once he tells me I'm going to turn it up, and when he tells me that that's enough, we're going to stop right there. We're going to hold it on that point for a period of 10 seconds. So we're going to hold it there, and at the end of 10 seconds, we're going to turn the unit down. We'll then move it to the second trigger point and repeat the process.